morning, everyone. First of all, let me congratulate Madan Gopal for coming up with this idea of getting insights into setting up a practice. Actually, normally nowadays we are well versed with all our training, but we don't know what to do after training and how to proceed. And we are out in the jungle, both for the patient care and as well as on the equipment purchase. And as all we know, this one modality of investigation, OCT, people have even tried, I was talking to other day with a good friend Javed Ali from LVP, and he was saying they are doing OCT as a routine even for lacrimal glands now, and also nasolacrimal duct. So OCT is a ever evolving technology, and it is making changes in both imaging as well as acquisition protocols day in and day out. No financial interest, but I was a grader for Optos 3D imaging. Why I mentioned this here is because this was the turnaround in imaging in future, which I will share with you recently in a couple of minutes. So before we decide which machine to buy, first of all, we should understand our type of practice. This is very important. Not everyone can have an access to a Heidelberg platform or a high-end Zeiss platform. We should also keep in mind what type of investment we are comfortable with. We should never allow us to be overburdened by an EMI, and also return of investment. I'm not saying the financial aspect of it, but also we should consider that the machine should pay by itself, because every year or every second year there is a software upgrade, there is a hardware upgrade, there are AMC and so on. So we should be able to break even this. All of us dream of getting an image like this before even seeing a patient, right from cornea to the optic nerve to even the choroid and sclera. But when you come in the reality, there are plethora of options, right from time domain to swift source to spectral domain and so on. So what reality also is that most of our patients, when they say, especially when it comes to a VR practice, you want to see them regularly, they are not even able to pay for your consultation, forget about the investigation. As in Tamil Nadu, we commonly call as cost illness. So coming back to the point again is there is a jungle out there. And in this jungle, we need to understand where we fit our practices best and what best outcome we can generate out of it. And let's look at a couple of options. I'm just going to take an example of one particular disease, because we need to keep it in mind that what is your OCT is going to be used for. So if you look at the options, the best ones, definitely the gold standard ones are always Zeiss and Heidelberg platform. We can discuss the nitty-gritties as we go during the talk. When you come on the economy side one, you have Apasami, Nidec, Topcon, Optopol, and the list is endless. Nowadays, even drug manufacturing company is coming up with an OCT. However, we should always look for what type of platform you are comfortable with, which way you want to interpret your scans, whether you want a swift source platform, you want an EDI, or you just want to stick to spectral domain. OCT angio is one thing which I always recommend to everyone, because this is one of the game changers, especially in the last 4 to 5 years. The more and more we are learning about OCT angio, the more and more versatility of this machine is increasing. And also, though we are in private practice, most of us, but research do play a part. So why I put a question mark here is, even if it is a small scale research, you want to publish some data with image acquisition, you need to have a good platform. You cannot have a Apasami machine and tend to do research. So these are a couple of points which one needs to keep in mind before committing yourself to any kind of a pharma company. Let's take an example of only one disease. As we know, this has undergone sea change. There was so much importance of biomarkers over a period of time, with so much of diagnostic modality available for neovascular AMD or any kind of macular degeneration. And these biomarkers have changed over a period of time. But the major game changer of understanding this particular disease was OCT. So this we have to keep it in mind. And this has been published over a period of time. The technology has evolved over a period of time we all are familiar with. But what has also changed with the newer imaging modalities is the era of swift source and EDI OCT. Why we keep this point in mind is, even if you are not having the technology, you can refer this patient just to get an image acquisition done at that particular center where this technology is available, and then we can prognosticate or treat these patients in a better way. So I don't have to stress the importance of what is the need of OCT in current practice, but now the imaging acquisition has gone even beyond a sub-micron level. Initially we were thinking, okay, 8 microns, 10 microns is good. Now then we thought 5 to 6 microns is good. Now we are talking about in terms of sub-micron analysis. So this becomes very, very critical, and over a period of time this biomarker changes has changed. We just take an example of serous. I have a pleasure of in our practice about 8 different machines of different platforms, but most commonly that out of 8 there are 3 are serous machines. So serous is what we commonly use, serous 5000 in that. But recently we just had to change the laser head of the software, the laser head of the machine, and in spite of having an AMC with us, we realized that the cost of the laser head was about 6.5 lakhs. So these things we have to keep it in mind. I'm not going to go in details. As I said, this is a mixed talk between the commercial aspect and also the visualization, what all the machine can offer. So these things we have to keep it very well in our mind. One, we are having the technology, but what is the revenue side of it? How much we can generate? And we cannot overcharge this patient. We cannot overburden our patients. I have OCT angio and I'm going to charge you X amount. That is not possible. So that is not possible even at the institute level and even in private practice. So these two things which we have to keep it in mind. And now what has changed over a period of time with any kind of high-end imaging machine is not only seeing these disorders at the different interface levels, but also what has changed is the dynamics of OCT angio. So OCT angio is going to be the standard norm of clinical practice. One example I'll just like to share here is a kind of this patient who presented with neovascular AMD, was on treatment over a period of time, and what you can see here is an OCT angio overlay of on a fundus fluorescein angiogram, and OCT angio doesn't miss out anything. The only problem here is we have to go to the machine and look at the different protocols, different acquisition scans, what has been taken, and take this imaging modality to a different level. Couple of other considerations also come into the mind when we look at all these patients are how far the technology can be interpreted by us as well. So it's not that you have taken the machine and the machine is going to tell you all the things. So we also keep this thing in mind. And with newer technologies like home OCT, again we have done this for about 3 patients or so in our clinical practice for patients who are immobile due to COVID related problems. And this is a very promising tool. What you can see here is a comparison of a home OCT image here, and this is a standard OCT what we are all familiar with. And at this juncture, Novartis is very kind that they are not charging anything on the imaging part for the patient. So this kind of things are going to be the future. So OCT, as I said, the plethora of imaging is going to move even forward, and AI is going to come in a very big way, which is going to tell you even the treatment schedule and what all you are going to offer to your particular patients. OCT A here is here to stay. Again and again I'm mentioning this, especially on the Sweatfloor platform. And there are so many varieties of OCTs now, pediatric OCTs. I think Mohit is here and he will agree that he needs this in this practice. You cannot do, go away without doing pediatric OCTs nowadays, intraoperative OCTs, and there are so many advances which are happening. But again, the bottom line is we should know what we want from our practice and what all we can do with that imaging modalities. Not every one of us can be fortunate enough to have all these technologies at their disposal and then use it. And even if you have the technology, I had a demo of intraoperative OCT. In spite of having so many years of experience, I was not at all comfortable using it. So we should also be aware of our limitations as well. It's not that you want this technology and that machine. So what we look at in the future is going to become a reality. We want a single machine which satisfies all these criteria, right from fundus photography to FA, ICG if required. And 3D imaging is going to come in a big way with wide field end-to-end aura-to-aura imaging of OCT. So what I want to convey today is, though Madan told me like, you give us the messages, which machine to buy, which one not to buy. I will go on the flip side of it and I will say, buy what is comfortable to your practice. And don't ever fall prey to pharma companies' hands, especially when there is a EMI burden, the practice pattern changes, which we have seen in a couple of centers happening, and that should not be your goal. Thank you so very much for a patient hearing and giving this opportunity, and thank you, Madan, for organizing this
Thank you, sir. Thank you. The message is well taken. So just one question that I'd like to put across when we're talking about imaging for the benefit of anybody who's going to start. You've spoken so much about OCTs and OCT angiography and fundus photography. What is the role of FFA today? I mean, I understand the research part, but if somebody is going to start out, where in the priority list does an FFA machine fit in?
Still has a very big role. Still has a very big role, especially when you have patients with CSR and AMD, which is not fitting the general criteria. We have a huge chunk of IPCV patients, so FA ICG definitely has a role. In fact, we had a privilege in a city like Chennai. There's only center in the private practice who has ICG, apart from the institute. So most of the centers don't even talk about ICG, but the FA ICG definitely still has a role. OCT angio, though it is it's a complementary technology, I will say, and it has a long way to go still. It's an evolving technology, and we also have to learn a lot many things before we start,